Hello everyone, I am Cecilia Dunn. I'm a student at North Central University and I would like to welcome you today. I'm conducting a presentation on evaluating couples' readiness for treatment. Okay, so our agenda that we will be going over today are, we will be going over our introduction, reasons that couples seek therapy, reasons couples resist seeking therapy with relationship issues, what is SRCQ and the marital satisfaction inventory, what are pros and cons of using these methods, how should a therapist approach an understanding of the couple's background and readiness if you do not utilize assessments. What are some ways, techniques, that I might use to approach informally assessing partners' experiences? How to tackle relationship issues from the case study, followed by a summary and references. In today's presentation, we are going to go over how to evaluate a couple's readiness for treatment. 1/3 of couples are experiencing relational distress at this very moment. When couples finally consider trying to get help, many of them have already contemplated divorce. There are many reasons why couples seek, however, there are many reasons why couples may resist getting therapy as well. 50% of married couples will determine that they cannot work things out and decide to divorce. Treatment includes using assessments such as the SRCQ and the marital satisfaction inventory. Other informal methods of assessing couples' readiness to work things out include questioning methods, in-depth interviews, which can help couples to learn how to communicate more effectively and learn how to gain emotional closeness once more. Discernment therapy is another informal method of assessing clients and is not considered couples therapy, but helps couples to look at the relationship to see what they have contributed in the relationship overall, as well as what path partners should take moving forward to either reconciliate or to separate. There are many reasons why couples seek therapy, and for one, both partners or one partner in the relationship will likely seek couples therapy because they are experiencing unhappiness in the relationship. Men and women seek therapy for various reasons, such as contemplating divorce, feeling as if there are communication issues, and feeling that they can no longer connect emotionally or physically. Research shows that women in the relationship are likely to seek help in therapy first. Women are more likely than men in the relationship to report that they have had problems engaging in sexual intimacy, issues in relation to how they care for their child or children, as well as jealousy issues. Reasons couples resist therapy. In researching reasons why couples may resist seeking therapy, findings show that in many cases, men may feel as if going to counseling means they have completely failed, or that they may feel shame in how others perceive them for seeking therapy. Couples likely have felt distressed in their marriage for more than a year, and they may feel like it is too late to try and solve the problems occurring between them. Other reasons couples resist seeking therapy are that the couples or the partner may have low expectations in believing that things can change, or believing that that partner will change. There may be issues with finances and insurance coverage, meaning that the cost of therapy may not be an option and insurance may not cover the costs. Couples may lack the knowledge of what kind of services they need to be seeking. Lastly, couples may resist seeking therapy due to one partner not having an interest in couples therapy at all. Okay, so let's go over what the SRCQ and the marital satisfaction inventory are. The SRCQ stands for the stages of relational change and is similar to the trans-theoretical model that measures intentional behavior changes. The SRCQ works by measuring the main 5 changes of change scale, starting with pre-contemplation, contemplation, preparation, action, and maintenance. It is unknown if there is a time scale for each of these stages. If a person is in pre-contemplation stage of change, that means that one partner may feel that they do not see a problem in their marriage and have not thought about how they can change in the marriage. The contemplation stage means that one or both partners now can see that there is a problem in the marriage and intend to work towards working on changing within the next 6 months, but likely has not set a plan on how to change currently. Preparation is seen as the stage where individuals are ready to change what is occurring within the month. Effective action is taken until the action stage of change, where the couple has not yet decided to change and they have been working on changing in the last 6 months. The SRCQ has 9 questions and uses 9 additional subscales from the Marital Satisfaction Inventory. The Marital Inventory is an assessment that provides a multifaceted measure showing how intimate relationships function. This inventory was created to identify the types of issues occurring in the range of unhappiness in distinct areas of how the partners interact, such as in areas of how the couples handle conflict, how the couples work through issues such as parenting roles and how they raise their children, sexual issues, as well as general satisfaction they both feel in the relationship. Okay, so let's talk about the pros and cons of using these assessments. In discussing the SCRQ, therapists may find that in utilizing this instrument has 3 clinical uses, such as 1. Allowing the therapist to evaluate their client's readiness or intervention for treatment. 2. Secondly, it allows therapists to assess where their client's partner stages of changes and if it's the same or different stage. 3. Thirdly, using these instruments allows the therapist to choose the right interventions for their client based on the stage of readiness to change. Other pros mentioned is that there is sufficient evidence that shows when clients are matched to the proper intervention for their stage of change, they can target the specific difficulties occurring, which enhances the therapeutic outcome. The cons of using this assessment can't tell a therapist whether a client is ready to change, but it does not explain what clients must do to change and does not allow the therapist to observe the client and how they reason, process their thoughts, and how they may interact with others. How should a therapist approach an understanding of the couple's background and readiness if they do not use assessments? Informal assessments can help the therapist to see what the client's viewpoint is by being able to openly communicate with the couples and gather information based on their unique perspective. Using assessments can make it difficult to observe important aspects of an interview, such as being able to build rapport with the clients and observe their body language, as well as being able to gain an understanding of the client's life narrative. A therapist using informal methods can approach an understanding of their client's background and readiness by using circular questioning, which in couples therapy directs questions to the relational system and not just each individual. The therapist would assess individuals to imagine how others may feel and to think beyond their experiences. The therapist would use open-ended questions which require a person to really think and reflect upon their answers. These questions are not simply yes or no questions, but require the individual to think deeply and give the therapist an idea of what their personal feelings are as well. What are some techniques that you might use to approach informally assessing partners' experiences? Discernment counseling is a treatment protocol that addresses relationships that are not sure about staying together. Couples who are considering divorce, where one partner may want to divorce and the other partner is still wanting to work things out. The therapist would also use a video to help the couples understand what other techniques will be used and what to expect in discernment counseling. I would use a questioning method such as circular questioning, which includes temporal, tridactic, and mind-reading questions. Temporal questions allow the client to look at what has happened in the past and allow the client each to give their perspective of what has occurred. Temporal questioning also allows the client to envision the future and what it would be like for the couples if the problems lessened or changed completely. Triadic questioning, which refers to how others outside the relationship may feel or behave as a result of the relationship of these difficulties occurring, so this could be family members or children. Mind reading questions is somewhat like triadic, meaning that the therapist is trying to understand how others outside the relationship may feel or think or say about the situation. The therapist will weigh the partner's history together and ask how they are affected in their current situation. The therapist can determine if the client is in a leaning in stance or leaning out stance by asking the clients open-ended questions. The therapist would give their client information and referrals about moving forward with a plan. They may decide to have the client consult a lawyer. Another questioning technique that is used is called the open-ended questioning, as well as the in-depth interview on what each partner has shared with the therapist, using a phenomenological approach. Questioning methods give the therapist insight on what the client is feeling about the situation, more self-awareness of what they are feeling on a personal level, and gives the therapist awareness of one's beliefs, meaning to what they think and how they see their relationships with others. So let's go over how to tackle relationship issues from the case study. Here is the following case study, and I recorded it so everyone can hear.
Here is the following case study scenario. Fred and Chris come in for a first session. Fred basically takes over the conversation and shares with you that there have been moments of infidelity where he has caught Chris lying about relationships he has had outside of their agreed-upon monogamous relationship. Chris only shares that he does not feel guilty at all and that he feels forced to come to therapy. Chris states that the reason for the infidelities is because Fred is controlling and that he was not satisfied with their sex life. Despite pushing, you feel Chris will not engage in therapy. Chris also seemed to blow off that he has any fault in the challenges. On the other hand, Fred is self-aware and willing to look at changes within the relationship and within himself to make the relationship shift. When asked if the couple has considered separation, Chris seems ambivalent, while Fred erupts in tears.
Okay, so using discernment therapy, Fred and Chris are what we would classify as a mixed agenda couple, where one partner is trying to make it work and one is ambivalent about making it work. It is clear to see that both partners have different agendas when coming to therapy. Therefore, they need the therapist to discuss issues with them separately as well as together at times, working on diverse goals. I would ask both partners to commit to at least 1 to 6 sessions of discernment therapy. I would tackle relationship issues by asking the couple to try and commit to these counseling sessions and hope that the partner who is leaning out would decide to try therapy. There are 3 potential outcomes, and these are that we would not see any changes occurring, secondly, that a couple would decide to divorce or separate, or that they would decide to give couples counseling a try. Overall, the goal is to help the couple to accept their path in an effective manner. Discernment therapy helps the couple to gain more clarity and assurance of what path both partners should take, looking at each other's contributions to the issues occurring in the relationship and really seeing what has happened in the relationship. In the case of Chris and Fred, they are not going to engage in couple skills, and this must be made clear to them. Discernment therapy ethics is that the therapist does not share what has been discussed word for word with the other partner. However, the therapist may discuss what the client may be trying to relay to the other partner. In counseling in general, it is recommended that therapists use diverse methods to assess clients, and the role of the theory is that it is not couples counseling, and discernment therapy only helps the clients to understand what should come next for them. The value of discernment therapy is that it helps to relieve pressure that one partner may feel about staying in the relationship when they will not find reconciliation. It gives a viewpoint from multiple perspectives while allowing both partners to make a decision based on what is best for them. It weighs the possibility of reconciliation while allowing the clients to get through this crisis that they are facing effectively. We are aware that today that 1/3 of couples are unhappy in their relationship and are either looking to try to fix the issues or seeking a way to separate from their partners. It can be difficult for couples to finally decide to come to therapy, as some couples choose to resist seeking help and going their separate ways. Using formal assessments can collect accurate data while assessing client stages of change based upon their answers. It also helps the therapist to match proper treatments based on their stage of readiness. Using informal methods helps the therapist to observe the clients through body language, verbalization, and how they interact with others. Questionnaires help to gather information from each partner's unique viewpoint so that the therapist can tailor treatment to help both partners where they are at. Thank you so much for your time and consideration in viewing this presentation. Here are the references I used.